So in that particular study, we looked at the proteomic characteristics on 21 different proteomic biomarkers and tried to see what is the relationship with the amount of blood flow that goes from the heart into the head, or total cerebral arterial blood flow in our study. And what we were aiming to look into this is to differentiate what is the effect of hyperperfusion or low blood flow into the brain, and what kind of proteomic biomarkers are related to that kind of state in people with multiple sclerosis. And there's a big debate between whether the blood flow will cause more neurodegeneration and atrophy versus the low blood flow or hyperperfusion can cause more inflammation and exacerbate the inflammatory state of MS. And what we saw in this manuscript, in this poster and now manuscript, is that the people who have lower amount of blood flow going to the brain and have hyperperfused brain not only have more damage as measured by greater amount of neurofilament light chain, but also had much greater neuroinflammatory biomarkers like the CXCL13. And when we looked at the proteomic composite scores, what we saw was that the amount of the hyperperfusion, or the amount of blood flow going to the brain, was really correlated the best with the neuroinflammation and immunomodulation proteomic scores, something that is a little bit different from the neurodegenerative scores that we initially hypothesized. So with this study, we actually were able to show that the hyperperfusion to the brain can result with increased proteomic changes within the neuroinflammation spectrum of the disease, and this will give us more ability to target hyperperfusion and inflammation in the future.